absolute pleasure to introduce Deirdre Stewart, Senior Director and Nurse Executive for Oracle Cerner, and Andrew Moran, Senior Health Network Executive for Oracle Cerner. They're going to be talking about the art of the possible, a digital future. Over to you both.
Thanks, Jade. Yes, hello everyone. I'm Andrew Moran. I work at Oracle Cerner. I live in Crieff, just north and west of Perth. Dee, do you want to say hello?
And yes, I'm Deirdre Stewart. I am a Senior Director and Nursing Executive with Cerner, a Cerner Oracle, and I live in Dalgety Bay in the Kingdom of Fife.
Thanks, Dee. So the format of our session, we just wanted to introduce Oracle Cerner for a few minutes, and then Dee and I share some stories about what's happening across the globe and what is the art of the possible with digital health. Please use the chat, pop any questions in there, and hopefully we'll have some time at the end, although I'm sure Dee and I could talk for hours on the subject, let alone the 20 minutes that were allocated. Okay, so Cerner Oracle is a global company, 26,000 associates. In Europe, we work in the UK, Ireland, France, Germany, Spain, Sweden, the Nordics, and we've worked in the NHS for 20 years, so 40 years of healthcare IT experience, 20 years in the NHS, 500 associates working in the UK, 152,000 NHS staff use our systems every day, and our Healthy Intent platform connects 10.7 million people across England. So Cerner provides three main products: Cerner Millennium, which is our hospital patient record; Healthy Intent, which is our population health platform, which connects data together, so it links to what we were speaking about in the main session. Some of our more advanced clients have connected hospitals, GPs, community care, mental health, hospice care, adult social care, and we're exploring the governance around children's social care at the moment as well. And we have a product called Care Aware, which connects bedside devices within the hospital and remote connections directly into the EPR. So again, linking to the main session, that's the automatic recording of information within the hospital. As Cerner, our three key themes to move forward in the digital age is to digitalize the records. So we need to move away from paper and into the digital world, connect the healthcare system together. So we no longer see hospital 1 and hospital 2, it's the person's record. And then to transform, so through our consultancies, our partnerships, the $800 million we invest in R&D every year, what is the next stage for the NHS for combining health and social care together? And what does digital proactive care really look like? We do work across the world, and Dee, I'll just invite you to come in. So as a previous community nurse that's seen both sides of that digital coin, can you tell us a bit of your experience of working in different parts of the world? And I suppose it's then, we both live in Scotland. How does it feel that the needs of our residents are met?
Yeah, thanks, Andy. I suppose having a background as a community health nurse, and this was sort of like a long time ago, having a background as a community health nurse, where my only technology at the time was really a notebook and a pen. I remember one of the things I remember most clearly, apart from the wonderful privilege of actually being able to work with people in their own homes. But one of the things was the amount of overhead that I always had, because having to write everything down and then having to walk everywhere to find, information, go and get the file, go to the doctor, get the prescription, go back to pharmacy, pick up the meds, take them down to the patient, make the notes from there. And I remember, because we didn't know any different at the time, so it was absolutely fine. But I think for me, one of the one of the sweetest times I had in my professional life, because I've been in healthcare information technology for over 20 years now. So there's been massive evolutions and revolutions during that time. But one of the sweetest times I had was actually seeing a full country go live, where the community nurses went live with their system, and that was part of a fully integrated, that was all connected to the electronic patient record. And then when I saw the difference that had made, I thought, oh gosh, that is just absolutely, that is absolutely fabulous. And that's when I was, when I spent time on the deployment in Qatar, for example. And that was, the way that has evolved is absolutely wonderful. I remember speaking to one nurse and saying, how would it feel now if we took this system away from you again? And she said, oh, it was so hard at the start. She said, I thought I would never get it. But she said, now I would rather you would cut off my right arm than take the system away from me. And that's what we want to start to get to here.
I suppose that's such a different experience, isn't it, to what's happening in Scotland now? So I can share a quick Scottish story. I recently went for an endoscope, which I don't mind sharing, but for the admission for my 20-minute procedure, there was 9 pieces of paper to which we filled in name and address at the top of every one. So in Qatar, they have Cerner products from primary care up through the trust. So I think that's the real transformation that you're seeing there in the care that's being delivered.
Yeah, absolutely. But I don't know. I think, Andy, I would just sort of add to that. For 2 decades now, I have been working with government bodies in countries all over the world as part of, sort of a team of partners that would come together, from consultants to suppliers to to the government departments themselves. And helping them to work out what the road mapping and what the strategy is towards completely integrated care and citizen care. And things that have come forward really strongly to me over that time is where there is a solid commitment. And that's why I was so happy to hear Jonathan Cameron's session just before coming in here. When you say it is you are designing at the citizen level, that is and where you make that happen, that is just so that is so elemental and so fundamental to success. And so sort of working with countries where they've openly stated, no, it's one patient, one record throughout their lifetime, regardless of where they are. And so this all would imply whether they're in hospital or in primary care, whether they're in social care, whether they're in the community or whatever. It is one patient, one record. That can be all done maybe through one system. It doesn't have to be done through one system. It can be several systems. And as long as they're all connected, then you are going to be able to, you're going to be able to achieve that. But the statements we want one patient, one record from womb to tomb, or from cradle to grave. These are the sort, when you embrace those as your philosophy and you see them come to life, I think that is absolutely wonderful. And I think I'd probably just add here that living in Scotland now for 5 years, I've seen these complete transformations in countries elsewhere. I have been part of those journeys. I can still walk back into those organizations and, I know them and understand them and see what they've done. And I think in Scotland, over the 5 years that I've been here, I have to say that I have never met a health or care professional here so far that I have not had the utmost respect for their professionalism, for their empathy, for their level of care, and to highlight how that has worked. My husband had metastatic bowel cancer and unfortunately died last August. We didn't have facilities for hospice available in Fife at the time, and I said I would help to look after him at home. And we had the community nurses come in and out. We had the GP come in and out. We had a hospital bed delivered. There was as much support given to me and my family as we could manage to make it as special as possible. And so that's where I have to say, it's like the people here can do it, and the people here will do it. But some of the things, if you think when somebody is in, let's say, the last 48 or 72 hours of their life, and they have breakthrough pain, and that breakthrough pain is extremely severe, when it takes 2 hours for somebody to be able to come to you to help out in the middle of the night, that 2 hours is a significant chunk of somebody's remaining 48 hours on Earth. And that was simply workload. So I know there's like workforce pressures here, but it also took me back, because when the nurses would come in, they would have to spend 10 to 15 minutes doing the paperwork before being able to give Ken his analgesia. And is that something that could actually be enhanced or sped up? Could we have been seen sooner? Could we have been helped more quickly? Could that last 48 hours have been a little bit more bearable if there had been a more integrated system? I'm sure it could probably have contributed in one way. So as a citizen here in Scotland, as a nurse and as somebody who has been well integrated into the system, I will put my hand up and help respond to that paper. I would love to meet with Jonathan Cameron at any stage, or with the people who are deciding the strategy for Scotland, and bring to bear experiences from around the world, because there are fantastic people here, and I'm sure armed with the systems that they need, and involving us as citizens to be able to input into that, it would be absolutely, it would be next level. I probably went a little bit off track there, Andy, but I will hand back to you.
Because what Jonathan was talking about, that used to be the future vision, but it isn't now. It's available today, and people are doing it. So in one of the areas I work in Wirral in northwest England, they have their hospice connected to the HIE and video consults, so they can see the medications and the paperwork that the hospitals are needing, and then they're able to take it further as well and move into that AI and machine learning realm. So before, when we all knew we were getting a COVID jab, but before the list came out that said sort of 80, 75, 70 going down through the ages, they wanted to know from all of the data that they have who was most at risk and needed it first. Their analysis showed that people with learning disabilities were most at risk of poor outcomes and admission to hospital, twice that of those with COPD. So you can then run special learning disabilities clinics. In America, they can push it even further into preventative care by saying this is where the food deserts are. So there's no fresh fruit and vegetables in these communities because it's too expensive. So the hospital then can prescribe fresh food to them. And it's that building on a healthier society. And I believe that's the reality today. And I'd love to see that across Scotland. I'm very excited about the strategy that they put forwards. We are running tight on time, Dee, so I would ask anybody with any questions to pop them in the chat or raise your hand. Jade's here to help us.
I can't see anybody with a hand up or any questions in the chat at the moment, but I will say we can certainly facilitate an introduction to Jonathan Cameron for you, Dee.
Yeah, that would be, and I think for a number of reasons it would. I mean, I really do look forward to more connected care here, and especially from a citizen perspective. I find it extremely difficult to live in an environment where there isn't that two-way communication. I think he was mentioning that two-way communication.
He was.
I had a skin condition which was probably brought on by the stress of my husband's death, but I had to wait 5 weeks to get an appointment. And I asked, well, look, can I at least send pictures in? And the answer was no. But when all of that is joined up, then it's going to make things an awful lot. It's going to make things an awful lot easier on the healthcare professionals themselves as well. Because things won't have advanced or got so far out of hand before you would actually manage to see somebody. June, did you have a hand up there?
Oh, you're on mute, June.
I was just unmuting when I was selected. Hi, thanks for that. That was really interesting. Because in a previous life, I did a lot of work with Cerner in England. I was just wondering, what benefits have you seen since being purchased by Oracle? How has that expanded your portfolio and and your product line, essentially, in terms of delivering benefit to your clients?
This is very, very new news, June. So for everybody else on the call, Oracle acquisitioned Cerner 2 weeks ago. So can we be completely honest? We've got a new logo.
Right.
And the wider plans, Oracle are one of the largest technology companies in the world, and that's what they're bringing to us. So the technology infrastructure layer will be improving. They spoke about cloud. Oracle runs the largest cloud in the world. So then how can we expand into the research areas, into proper AI and into machine learning? So when Dee sends her photos of the skin conditions in, it can recognize the cancer earlier. We're right at the start, June. Sorry, we haven't got a better update.
Oh no, it's not a problem. I didn't realise it was so soon. Yeah. I just seen an announcement a couple of months ago, but I mean, I can only see.
There's lots of regulations and stuff to go through. Sorry, Dee.
Yeah.
No, I was going to say it, from anything I have seen so far, June, there is huge excitement on both sides and huge positivity on both, well, I say it's not both sides now, it's Oracle Cerner. Great.
Okay. Thank you for that.
Welcome.
Look forward to good things. There's a question from Elaine who had her hand up.
Yes.
Hi. It's only that you were saying about like patients having to keep filling out these forms and everything like that. And I'm in IT, so I know what people are moaning all the time. But when I go to the doctors, they don't tend to do the papers anymore. It is in the system. They go straight into the system, or the nurse does.
Yeah.
Because is it just some that are doing that, or it's not the same throughout, or what you change in there then, because they're not writing it anymore?
So I was at Perth Royal Infirmary, so I do hope to see improvements there. So in our Cerner clients, everything's digital. There should be no paper records anymore. We're transitioning their medical records over, and then when you go to see the GP, the interoperability, when they are connected, it then shows your hospital record. You don't distinguish between the two. It just says this is what happened, to the person. So I think in Scotland there's still patches of it, so the digital maturity journey, but we need to make sure that it's not concentrated in certain hospitals. The whole country needs to be pushed forward, especially when we're thinking about the more rural communities. If the internet is going to be everywhere and we've got 4 and 5G, then they should have exactly the same access to anybody inside a hospital.
Yeah, no, absolutely. Yeah.
Yeah. And I think also in relation to that, what I see here is a lot of what I've seen in other smaller countries, and that is the mobility within the country. So those that sort of they might live in Edinburgh, work in Fife, they might live in Fife, work in Glasgow. There's a lot of there's a lot of travel north, south, east, west in Scotland. And so making sure that that's sort of integrated. Again, if your record follows you wherever, and whatever whatever the platforms are, as long as they're connected and you're able to share that data, then that is going to be able to go with you. I would also mention, it's really important to try and connect the privates and the public as well. And I don't know whether that has been done anywhere, but I haven't seen it done. And that's really important. You know, if you're sort of like on a let's say a chemo regime in a private hospital, but then you need to go to your GP and none of that information is available, or you have to go to the hospital because of an emergency with sepsis or something like that. So where is that? Where is that information? You know, what systems are they kept in, and why can't it be shared at a citizen, you know, at a person level to the healthcare providers?
Thanks,
Thank you
Elaine.
for that question,
Richard?
Elaine.
Yeah, I just wanted to add that a lot of these things have been worked on by the UK's military, which has had dispersed services all over the world. They don't go with a full retinue of specialists everywhere in the world. Most of the reporting of images is not done in theatre, but is done at home. And I just wondered whether you intend to take advice and see what the military has learned and what remain the problems, etc.
Is that to Andy and myself, that question?
Yes.
Is it in relation to Scotland, or
in anywhere in the UK?
Anywhere in the UK.
Well, I suppose we don't have any contracts with the UK Ministry of Defence. In America, we have the Veterans Association and the Department of Defence, and we're working on rolling what would be essentially one hospital system. So we call it shared domains, convergence, but it wouldn't matter where you went, where you lived, as long as you went. You know, if you're in the military and you go to one of their hospitals, the data is there. And then we are a very open organisation as Cerner, and we have APIs in and out, and the interoperability is really important to us as well. So we'll work with every major supplier of health and care information. If your records are with us, we'll make sure that they're getting to the treatment centres to where you are.
And it's already been done in places like Abu Dhabi and Qatar, where again your services are remote, like your radiologists are remote, and they can access the system, they can report on it. But same with laboratories, where you're sort of like networked to community laboratories or countrywide laboratories and bringing that information in and out.
And in Scotland, it makes me think of the cancer trucks that travel around the Highlands as well.
Yeah.
If I live in Ullapool, I'm not going to Inverness for an MRI of my mammogram, you know, and the truck comes to the co-op car park. But if they're connected, we can have the specialists seeing the information straight away.
Let's hope that this all does happen then. It'd be fabulous.
It's happening, Jade. It's happening, Jade.
It is. And I think I would just round out by saying, you know, I've been in places where you can put the exact same thing into the exact same type of organization, and it can be a huge success in one, and it can be a bit of a damp squib in another. The differentiation being the governance, the leadership, and the people who are working on it. Like, informatics is such an exciting career. I was speaking to them in university in Belgium this morning just about that, how to build informatics into, you know, sort of like into the training program for nurses, for doctors, for allied health professionals, for everyone, you know. And so the future is, it is very, very bright, and it is the people who will make it. And the people in Scotland are the best I have yet encountered when it comes to the care that they give to us as people. So the recipe is there. The cake just needs to be baked.
Absolutely.